A new UW Health clinic is looking to minimize complications with anesthesia before surgery. The pre-anesthesia clinic just opened up at East Madison Hospital a few weeks ago, and joining us is the medical director of the new clinic, and you might know his face because he's a familiar face around here. It's Dr. Bill Hartman, who joins us every Thursday. And out of all the hats you wear, doctor, our viewers may not know you're an anesthesiologist or a pain doctor, and now you got this new clinic. Big congrats on that. What is a pre-anesthesia clinic?
Well, thanks. And yes, I actually do practice as an anesthesiologist. That's where all my clinical training is, and the medicine that I do every day. But the pre-anesthesia clinic is a way right now for us to evaluate patients prior to them coming to surgery. We want to make sure that any of the patient factors that could contribute to complications after surgery, that we're aware of them and that we're able to modulate them or manipulate them in some ways to help improve that patient's surgical outcome. We know that most outcomes are quite good, and we know that most complications are not due to the surgery themselves, but rather these patient factors. And so we really want to pay attention to these to make sure that the surgery is not only safe for the patient, but that patient has the absolute best result they can have.
I found it interesting. It's basically a place you can go so you learn as much information about that patient before you do these big surgeries sometimes, right?
Right. You know, we want to know how good is your heart? How good are the lungs? Have you ever had stroke? Are you a smoker? Do you walk daily? We want to know all these things because they all contribute to having a very successful perioperative experience. And for us as anesthesiologists, we really are committed to making sure that this is a safe environment and that things that we do can influence how well your surgery goes and how well your recovery goes.
Yeah, and I saw the National Library of Medicine actually did a study on these types of clinics. No surprise here, the research shows that they work, and not just on reducing hospital stays, but something I think people don't think about. Also, the canceling of procedures, it minimizes that. That could be a big deal for patients, right? Right before they're about to go into surgery, suddenly that's when you find something out about them.
Right. You know, it's a big deal for patients and a big deal for the hospital systems. For patients, they've already taken time off to have their surgery and to recover from their surgery. So cancellation is a big inconvenience. For hospitals, so there's a huge cost of canceling on day of surgery because they've had everything set up for that particular patient. Now they have to put it all away, and that room can't be used for something else. And so all of these things will be minimized by us knowing these patients very, very well and having them ready on the day of surgery at the time they're supposed to have the surgery.
And I know this is open to anyone at UW. I know you're at East Madison Hospital, but literally anyone in the system can come to this new clinic. If you're not in the UW health system, should this be something you should be talking to your doctor about before you go in for that big procedure?
You know, I think so. I think that people don't really understand the risks of anesthesia and being under the care of an anesthesia team. This helps explain that. It makes people a little bit less anxious, and it really helps improve the overall process.
Dr. Bill Hartman, the new medical director at the pre-anesthesia clinic that just opened up over there at UW Health. I'm glad we know the man at the top. If we have any questions about the clinic, we're coming straight to you.
Great. Thank you.
Thanks, Doc.